The Capitol is closer to a much-needed facelift, and Medicaid audits could result in better access to medical care. Details in Capitol Report. Hello, everybody, and thank you for tuning in to this week's Capitol Report. I'm Julie Bartke. It's been nearly a year since Senator Sean Nienow and Congresswoman Michelle Bachmann led a news conference highlighting the probability of overpayments made by the state into the Medicaid program. Tuesday, he continued his mission to provide what he says is much-needed transparency in the Medicaid payment process.
You know, the hardworking taxpayers of Minnesota were overpaying, and they weren't getting the providers, and they weren't getting the services that they needed to get their health care taken care of. And that was, you know, I will put the blame on wasteful government, because if you read the Scalze audit, DHS asked for this data, and they got pretty hard pushback from the HMOs, and DHS said, okay, we really don't need it. That's where the problem lies.
If we are dedicating $8 billion today toward Medicaid, and we have Minnesotans who are being literally denied care that they deserve and that the state says and the federal government says that they should get, and now we're going to expand that care, we can't allow this to happen, because it's almost like a funnel. $8 billion goes into the funnel, but somewhere along the way, that money isn't getting to the providers that are giving the care. That money isn't gotten to the people who need and deserve the care. It's getting caught in the funnel. And we know that 100% more profit is going to the HMOs than they were designated to get. That is simply, bottom line, not acceptable.
Our fees are based on the median fees of 1989. That was when my daughter's born. She's out of college now and working in a hospital system in an ER.
And that's been cut.
That's right, and that's been cut. So it's a problem, and as Senator Nienow pointed out, it's not only overcharging, but it's not using the resources for where they belong. They belong to the provider to do the service, to take care of our people. So instead of returning hundreds of millions of dollars to the federal government, to the state government, and we want to be thrifty, but we need that for care. So it's a two-edged sword here.
Here to talk a little bit more about that press conference that we just showed you, we have Senator Sean Nienow. Thanks for joining us. We appreciate it.
Glad to be here.
Let's talk about this issue and the Scalze report. Specifically, as you encapsulated in that news conference, you stated that it found that Minnesota had overpaid by at least $200 million and that there just wasn't enough data to support what had been paid. Let's talk a little bit more about this problem and what you took from that report.
Well, what I took from that report is that the questions I've been asking for the last 2 years were legitimate. Unlike what many people said, no, not a problem, not a problem. The Scalze audit said, yes, there is a problem. We have been, at least during the audited years, we have been overpaying, and we have not been identifying and reviewing the underlying paid claims data. We had one piece of that paid claims data, but not the full spectrum, and you can't do an analysis with only one piece of data. So what that's resulted in then is those overpayments, and we don't know if we're getting what we're paying for. Well, clearly we're not. Scalze said that we're overpaying.
And it also talked about access to medical care and how some of this money wasn't going to the providers. It was resulting in some dentist offices in particular closing and people not being able to get into doctors. Did anybody see this coming?
Well, I think the providers, the dentists, the podiatrists, those that are particularly feeling the pinch in the reimbursement rates, which is related to budget and how much we have to pay for these programs. And if we've overpaid $200 million, that's money that either could have been used to expand the programs or, more likely, bump up those reimbursement rates so that dentist, for example, wouldn't have had to close his office and make 1,500 people go find health care somewhere else.
So let's talk a little bit about what you consider the solutions, and also the fact that you said $200 million might just be the bottom end of this. It could actually encapsulate to almost $500 million?
Yeah, Scalze identified $207 million. And they also said that they looked at MSHO, the Minnesota Senior Health Options, which is another third of the program. So just do the math. That would mean, by extension, another $100 million overpaid. And then there's all the investment income off of that money sitting in the bank for 10 or 12 years or however long. That could be another 150 million. So now you're talking in the $400 to $500 million range.
You have a couple of bills on this issue. One would increase transparency by calling for audits, and one would dictate who gets to keep the overpayments. So how are these moving through the process at this point? And are the people who didn't say that this was a problem before now understanding and identifying that there could be a problem?
Well, I think they are. I mean, well, they have to acknowledge it now. We have an independent, well-respected firm, Siegel, nationally respected, who says, yes, there's been a problem. And now it's our job as a legislature, working with the governor, to get that rectified point in time going forward, but also looking back. I use the analogy of, I go to the store and I grab a pair of shoes off the rack. I really like them. I drop them on the counter, hand the clerk a $100 bill. I think I said this in the press conference. The clerk scans it, keeps my money, gives me the shoes, and says, have a good day. And then when I walk out the door, I look at the price tag and it says $49.99. I just overpaid $50. I should get my money back. And so that's, I think, something we should take a look at. If we truly did overpay $200, $300, $400 million, the state, the hardworking taxpayers, are due their money back.
Would it go back to the taxpayers, or would that money go back to the state, who can then maybe pay off, or maybe throw it into the general fund, or get the budget reserves higher?
Well, one way or another is going to go back to the taxpayers if it were to happen in this budget, because we have a budget deficit. So that would mean either more services for the taxpayers or lower tax increases. And
you just touched on my next question. Do you think you can do something with that in this legislative session?
Possibly, yeah, very possibly. I know the House is very much working on that. They have that in their proposal. They're trying to get some cash back. So,
Senator, of course, we have to touch on your stadium legislation as well, which would essentially delay groundbreaking on the new stadium until it could be validated that there is money coming from the state that could pay for it. Exactly. So, what kind of reaction have you received, and is it a realistic piece of legislation in your opinion?
Well, the reaction is overwhelmingly positive, tremendously so. And
from people or from legislators?
Both. Some of the stadium proponent legislators think, give it time, it'll work itself out. I think if you do the math on the electronic pull tabs and then bingo, et cetera, the money's just not going to show up. And when we let the bonds, we're looking at $30 to $34 million a year for 30 years, which is nearly $1 billion that we're going to have to figure out how to pay for. And to be more technically accurate, it wouldn't necessarily delay groundbreaking on the stadium if the administration would find that revenue source and certify it. So everything can stay on track. The bill really is targeted towards finding the dedicated revenue source to pay the bills. Because if we don't find the $30, $32, $34 million a year that we will need, then it's going to come out of education or healthcare or fixing the roads or all of the things that we pay for in the general fund. And the governor promised, and the bill proponents promised, we would not use general fund money, but right now that's the track we're on.
Well, and to that point, the governor did say he thinks it's still early in the process and nobody needs to panic. However, he is open to looking at other sources of revenue, and he's actually called for some of the players to come together and just start investigating what those are. So is it time to kind of sit back and see how this plays out, or are you going to, what do you do? How do you move forward?
No, the numbers don't say that it's not time to, well, maybe not panic, but it's time to be greatly concerned. The revenue estimates, or the revenue that we're getting in, are 95% below the revenue estimates. Some of that is because the E-tabs aren't in as many bars as they thought, but we're not going to get there, I don't think, because the E-tabs in the bars where they're at, on average, are only producing about half of what they estimated for volume and revenue. So even if they could get it fully implemented, we're still short by half, by 50%. And when the electronic bingo comes in, if you read the revenue note on the gambling revenue note, electronic bingo was only going to be 15%. So you can't hang your hat on electronic bingo being the fix. Unless the governor's going to go into creating little mini casinos at every lottery retailer, which they could try to do. Unless they go down that kind of path, they're not going to fix it with what we have right now.
Is there another revenue source that would get your stamp of approval?
Well, we could take well, I actually changed the bill when it was here last year, and I put in Racino specifically because, not because I'm a Racino proponent, but because I didn't believe the revenue was going to show up, and I thought we should have an honest revenue source if we're going to do this, rather than making taxpayers kick in another $30, $35 million per year. You look at user fees. I had a couple of proposals that I floated. I never got into the bill, dedicating some of the sales tax revenue that comes off of Vikings-related paraphernalia, looking at user fees on seats, maybe capturing some of the seat licensing, things like that. You can get there. It's just a matter of identifying it and certifying it so that we know what we're using.
And I guess same last question as with the last issue. Do you think this is going to get any movement in this legislative session?
I don't think the bill itself is likely to become law. It's accomplishing its purpose. It's forcing people to talk about the issue. And I think to that end, yes, it's going to accomplish something.
Okay, Senator Sean Nienow, thanks for your time. We appreciate it.
Thank you.
This group of lawmakers recently stood together to unveil legislation that would legally recognize civil unions. Representative Tim Kelly, the author of the House proposal, highlights the key points on our Capitol Report set. Let's begin with your legislation. And essentially in the news conference, you said this would allow couples in civil unions the same legal rights as married couples. Why don't you specify what some of those rights would be?
Well, I think the issue generally has been, I mean, if we go back a couple of years ago when we were first having the conversation, of course, when we were looking at putting the amendment on the Constitution, it was all about the issues in statute that are discriminatory. And there is a group out there called Project 515 that suggested there's 515 things in statute that are discriminatory towards the gay community. And so that's what I initially started with is thinking, how do I attack these 515 issues if we want true equality and stand up for individual rights? So in researching that and going forward, it was brought to my attention that civil unions actually would do that a lot better than trying to pick out, statute by statute. So I guess that was the reasoning for it. But there's a long list. I think probably one of the main ones as an example is if you go to work. I mean, and that was one of the things that was stressed in the press conference. Does this suggest that same-sex couples could get health benefits, for example? And the intent of this legislation certainly is if a company is offering that to married couples, that they would need to offer it to same-sex couples.
Would it also then, would the intent be to perhaps change the state's tax code so that they could file jointly as maybe the equivalent of a married couple? I mean, would it reach that far as well?
Well, if it could. The unfortunate part of that is that that's a federal statute, and we cannot change the federal side of things. And that's even with Senator Dibble's gay marriage bill, that won't change either, because that's a federal issue.
What are some of the other things that wouldn't change?
Well, a lot of the issues are certainly federally mandated, and there are some things in code that are ERISA statute. That's again federal code. So anything that the federal government dictates and mandates and that is in federal statute, we can't change as a state, no matter how we do it.
You said in the news conference that you were a bit surprised that you even had to bring this legislation forth, especially this late into session. Why were you so surprised?
Well, I really do believe that this was the way forward. I think this is what we should be doing. Again, I go back to my message on the House floor 3 years ago when I stated that I didn't believe it's government's role to define marriage, but it's absolutely government's role to protect the individual and to make sure that we all get the same rights. So I thought that this was the way to do that. In fact, when we were fighting the battle against the amendment, most of the opponents suggested this is all about discrimination. It's all about just give us the rights. So I'm a little surprised that we jumped all the way to thinking that the mandate, because we voted down the amendment. I don't think Minnesota said, okay, we want government now to go all the other way to define gay marriage or to define marriage itself. So that's why I was surprised, because I thought the Democrats actually would bring this forward, because I thought it was a very logical way to get individual their rights.
Do you think, I want to take what you just said a step further, there are currently 10 states that have some sort of same-sex or civil union legislation, and so given the defeat of that marriage amendment in the last election, do you think voters sent any kind of a message that they're ready to join that number, even in the capacity of civil unions?
I do think that, and I think it was a matter of, because what we saw the defeat of the amendment, but we actually saw if we look at all the numbers, I believe it was 78 out of 87 counties actually voted to put the legislation on. So I think we have to make sure that we're understanding that balance. So the way I saw that, I'm reading it from a perspective of the populace, is to say, we didn't want you to put it in the Constitution. We don't like government having that role. But we don't want you to also tell me what to believe. Just like I shouldn't tell you, Julie, what you believe marriage is, as I wouldn't want that to be dictated to me. And so I'm strongly opposed to government doing that. But just as strongly as I'm opposed to that, I'm much in favor of government standing up for the individual's right to believe whatever they want to believe.
When the same-sex marriage amendment was going through the legislature, I'd like to get your thoughts on this. A part of the criticism towards that ban was that it was hurtful and that it was painful, that people in same-sex relationships couldn't have the same status as married couples, even in just allowing for people to, allowing for their love to be expressed. And so, do you think that this legislation could also be perceived as hurtful and painful to people who are in same-sex marriages, or do you think this takes a step in a positive direction?
Well, of course, I feel like it takes a step in the positive direction, but I understand that I'm looking through that in a different lens. So I understand the passion and its emotionally charged subject. But what I've seen, certainly, and become more acutely aware over the years, is that I've had gay couples, for example, bring me their wedding pictures. They have gone through a ceremony, and they've got their wedding pictures there. So I presume they believe they got married. And now whether Minnesota recognized that or not, that's certainly the issue. But if they did that and they got married, they believe between the two of them, their church and God, that they're married. But so it begs to the question, what don't you have here in Minnesota? Well, in my opinion, you didn't have the rights. So you will always have the ability to go out and get married at a church if they believe they will marry you, but you didn't have the rights. So I thought the logical step in this case was to take that and give them the rights and benefits of heterosexual couples that also get married. So I believe it's a step in the right direction.
Okay, our last question is, how, at the time of your news conference, you said you didn't have a lot of support for this legislation yet. So kind of walk us through the process. How do you intend to proceed here? Do you want to have a hearing on this right away? Do you want to kind of sit back and see what happens with the same-sex legislation that could move through this session? How do you move forward?
Well, I am going to request a hearing on the issue. I do believe I've got support for it. I think a lot of people are kind of weighing the balance here and talking to their own districts, which they should. I'm not going to speak for any of the representatives or senators, of course, but for the number of people who have approached me and wanted to talk about the subject, I'm very encouraged. I think there's quite a bit of support. Now, the one argument that I've heard that I think has some merit, because they say if you believe that everyone should be equal, what about taking the word marriage out of the definition? And I think that's intriguing, because I can tell you right away the reason I didn't is because I wanted to be realistic too as to what would pass. If we start looking at that, my impression was that I would invite a fight that I thought, why fight both battles at once? So I thought this was maybe a kind of a step towards the right direction, and then we would worry about the rest down the road. But I think that's an intriguing argument and something that I would also look at.
So you hope to get something moved through this session, or are you willing to wait until next year?
I'm looking at moving it through this session, absolutely.
Okay. Representative Tim Kelly, thank you for sharing your legislation with us. We appreciate it.
Thank you, Julie. Appreciate the opportunity.
The Capitol restoration is in. The Mayo Clinic expansion project is out. Governor Mark Dayton released his 2013 bonding proposal on Monday. It totals $750 million, with the largest amount, $109 million, directed to the state capitol's aging infrastructure.
We can either decide if we're going to do a comprehensive project today, or if we're going to see scaffolding like you have seen around the building for the next 50 years. And so we can either do this once and for all and make sure that we are preserving this capital for the next 100 years, or we can see this in a constant state of asset preservation.
This was the scope of a bonding bill we anticipated. As I said, there are a lot of really vitally needed projects that had to be left out. And given the backlog from previous governor's vetoes and from legislative lack of legislative support the last 2 years, there's just a huge need for it, and the interest rates are extremely low. And we have a lot of people, especially in the building trades, who need work, want to work, and this will put them to work all over Minnesota. So those are the combination of reasons.
Senator Bev Scalze might be new to the Minnesota Senate, but she joins the ranks of many others who have made that transition from the House. She sat down with us to discuss her priorities.
Well, I'm a small business owner and operator. I go to work every day at 8 o'clock at my little heating and air conditioning office. I work there until 10 o'clock, and all of my committees are in the afternoon, and then I work until at night. And I'm also a wildlife artist, so through my life, I've worked on environmental issues as well as business issues. And so I'm on some committees that kind of put all of those together. I'm on the Environment, Economic Development, and Ag Finance Committee, which has been a fun one. And I do bring, I think the business side of me makes sure that things make sense, that they can exist, and so we're working for the future. I mean, when you run a business, you're looking toward the future. You don't want to be just in business this week. But I've also been a wildlife artist through the years, and I'm very conscious of water and woods and what goes on in Minnesota regarding conservation. So I work on water issues here at the Capitol.
And you're also the vice chair of the Capital Investment Committee. Let's talk a little bit, as bonding becomes more of an issue. Do you support a large bonding bill, both this year and next year? How do you sit on the issue at this point?
I have always supported a large bonding bill because as we look at other states, and we should compare ourselves to other states to make sure that we're not an outlier in any particular area, except the ones that we want to be the best, like #1 in education. But a bonding bill is a jobs bill. And we have lower debt than most other states. So we know that we're not doing wild and crazy things with bonding. And we're in the bottom of the pack in that respect. And when we do bonding in Minnesota, the people then are paying for the projects for which they are getting the benefit at this time. And I think it's very important for Minnesota. These are good private jobs all over Minnesota, not just metro, not just rural, all over Minnesota, providing great jobs. And the bulk of our bonding bill is usually renovations and maintenance on our higher education facilities. And those are good private jobs in every area of the state and keeps our buildings up to par, which is very important. That's planning for the future.
And would you agree with the governor that it's kind of now or never as far as this Capitol restoration project? And do you think that should be in a bonding bill or perhaps
Absolutely.
a standalone?
Absolutely. Well, I don't think it should stand alone, but I think it's very important. We think that right now we are at such a period in our history where interest rates are very low and contractors are bidding very low to try to get the jobs. This is the most opportune time. I remember the 80s and the 90s, and things were very different. And the interest rate is so low now that it's been good for the state of Minnesota and every other state as we even refinance our bonds to get a lower interest rate. It makes sense. In your campaign literature, you state that transit and K-12 education are two very key concerns for you. Do you support the direction the Senate is taking in these areas? I do. I think we really need to put more money into early childhood. That's the one area where we need the workers for the future. Right now we have 5 workers for every retiree. In 2030 we will have 4. 2020 we will have 4. But in 2030 we will only have 3 workers for every retiree. So the math doesn't work. We need to have everyone in our state educated and ready to go to work. It's a math issue. And let's talk a little bit about transit. You emailed a questionnaire to constituents asking for input on ranking budget priorities and on heavy traffic areas that might need attention. There were several questions there. Where did transit kind of fall into it? And what did you hear from your constituents? Well, you know what we heard from the constituents is that they want the highways to work a little bit better. My cities are like second ring suburbs. So what we have in my cities is everyone from all over the state wants to get to the Capitol or to St. Paul or Minneapolis. They go through my cities. I've got 12 lanes of concrete going through my cities, very small cities, 10 and 12,000 people. So it's a huge part of our city with all this concrete going through it, and there's backups, and that's not good for anyone. It's not good for the noise, it's not good for the pollution, and we need to get people through the Rice Street Bridge over 694 so that they're not sitting there for hours on end. That doesn't do anybody any good. And we've had testimony from Cummins Power Generation. We've got companies like Land O'Lakes and H.B. Fuller and St. Jude Medical. It's not good for their business to have their customers, their employees, and their visitors stuck in traffic and not be able to get across or underneath a bridge.
And Senator, according to what I read, you decided to run for, run for the Senate because there was an open seat, courtesy of redistricting.
Absolutely.
So what has this transition been like for you coming from the House?
Well, it's been really exciting because, as I said, it's an open seat. I've served 8 years in the House, and so I know how to kind of get the job done here. And I have 2 new House members who have never served in an elective office before. And I'm in the best position, and that's what I thought when I decided to run for the Senate. I would be in the best position to help those 2 new House members succeed for the needs of our district.
Have there been any big surprises with the Senate thus far?
Really, no. The only surprise well, it's not something I didn't know, is that the workload is twice as heavy because, of course, being a House member, there's 2 for every senator. So we're doing twice as much work for every House member, and we're carrying bills, lots of bills for the House members, and because you need a House bill and a Senate bill to succeed on any particular legislative effort.
And at the time of this taping, we are in the thick of things. What is your impression of it thus far, and is it meeting your expectations?
It's interesting because at this point, and it is my expectations, at this point, we're working with our chairs, trying to get things through. And we're also working with the other side of the aisle. I'm kind of a moderate person, and I've long been able to work both sides of the aisle, and that's what we have to do to gain the votes in order to progress our bills and to get positive votes. We have to work both sides of the aisle. We can't just be one party or the other.
This group is rallying to raise awareness that HIV and AIDS are still issues and that the proposed budget cuts to Health and Human Services should not touch this population. As AIDS Action Day came to a close, there were compelling stories told to the crowd.
My results came back positive from the first test, and the information for me was devastating, as one might expect. At the time, we had no medical intervention or treatment that could prolong our lives. The best we could hope for was to improve the quality of the lives we had remaining. During the years following, I watched a greater part of my community wither and die. Somehow, I was one of the people who survived. I used my graduate work in mental health to design and deliver programs encouraging people to engage in safer behaviors and to get tested.
I was diagnosed with AIDS in September 2004 while undergoing treatment for chemical dependency. My initial reaction was to take my own life because I did not know or believe that there was any hope or chance of living a normal, happy life. The thought of a slow, humiliating death was more than I could handle. I was scared, and I had no idea where to turn or what was necessary to treat this devastating illness. Through RS Eden programs, the Minnesota AIDS Project, Hennepin County Medical Center, Mentia, Program HH, and the Ryan White Fund, I was able to formulate a plan of action to treat my illness along with my chemical health. The last eight and a half years of my life have been nothing short of a miracle.
That concludes this week's program. From all of us at Senate Media Services, I'm Julie Barkey. Thank you for watching this week's Capitol Report.